views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and as always, encourage you to continue participating in the program by dialing 718-960-7261. That's 718-960-7261. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. You can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing the diagnosis and treatment of strokes.
Yes, Errol, with recent medical advances, as well as a better understanding of the very serious medical problem, we can often reverse the severe consequences of a stroke. And joining us this evening are two experts in the field, Dr. Manju Dalu, a specialist in neurology with extensive experience in the field, and Dr. Stephen Gottersfeld, Director, Quality Improvement, and also a highly respected and specialized in drugs. Both of our panelists are key members of Bronx Lebanon Designated Strokes Center. Welcome.
Thank you.
Now, before we hear from both of you, our panelists, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7261. That's 718-960-7261. And please call us. Now, Dr. Diallo, let me start the program by asking you to define for our viewers just what a stroke is.
Sure. Thanks for having us here. So stroke is a condition, it's a sudden onset of loss of body functions. It can be loss of strength on one side of the body or the other.
Right.
It can be loss of sensation, eyesight loss, and it can be loss of balance, like dizziness. So it's sudden loss of body function, and it can be ischemic or hemorrhagic strokes.
Right. Now, Dr. Gottersfeld, perhaps you can expand on Dr. Diallo's answer. Can you tell our viewers what the difference is in the different types of strokes?
Well, there's two main categories of strokes. One is ischemic stroke, and that's typically to either a blood clot that's traveled from typically the heart into a vessel of the brain, or from just an occlusion of a blood vessel in the brain from long-standing atherosclerosis, probably from diabetes or hypertension or high cholesterol.
Right. Yeah.
The second common cause of stroke is a hemorrhagic stroke, and that's maybe 20% of strokes, and that's bleeding into the brain from a rupture of a vessel.
Okay. Well, later on, we're going to talk about some of the remedies that are out there for people that come in with strokes.
Sure.
But now I'll turn it over to you, Dr. Gums.
Yeah, a question that comes up frequently from a family member is exactly how do you distinguish between a migraine headache and a stroke?
All right. That's a good question. So if you look at the migraine and strokes, migraine happens generally in younger population, whereas stroke happens in elderly population or more than 55 years of age. Migraine, all the time, it comes with an aura, and it's followed with a headache, whereas stroke may start with a headache, and you can have the weakness subsequently.
But what about age?
So age, migraine happens in younger population,
Yeah.
and stroke happens, majority of the times it happens if a person is more than 55 years of age. Although it can happen in younger population too,
Yeah.
but majority of the times it's age above 55 for stroke and less for migraine.
Okay.
Now, Dr. Gottersfeld, expanding on what Dr. Diallo just said, How does a family or even an individual know whether to come into the emergency room or even call 911? What are your recommendations?
Well, we all know that most migraines are a headache, and strokes are generally no headache and neurologic deficits.
Right.
However, it's never that simple, and
Exactly.
frequently the definitive diagnosis of a stroke can be very tricky and subtle, and it's not expected that a layperson, a family, can make that diagnosis at home. It's highly recommended that 911 be activated and let the experts discern whether this is a migraine or a stroke.
Because time is, you want to mention?
Well,
Time is
sure.
important, isn't it?
Yeah, the treatments for strokes are very time dependent. I mean, there's a very narrow window of therapy, and delays can lead to loss of brain tissue.
Okay. Dr. Curtis, in this type of situation involving distinguishing, helping me out?
He's really talking about the designated stroke center
Yeah.
that we have. How does that work at the Bronx Lebanon in terms of distinguishing the stroke aspects versus the migraine aspects? What happens in the designated stroke center?
Well, the designated stroke center is a hospital that's proven to have the capabilities to treat strokes 24 hours a day. It's a team approach. Radiology, neurology, the emergency department team, and once a patient arrives with the symptoms suggestive of a stroke, the team has to make a rapid assessment, bring the patient to the CAT scanner as quickly as possible to rule out any condition that might prevent the use of thrombolytics, and then bring them back to the emergency department for analysis and for thorough evaluation, make a decision whether this patient is having a stroke and whether they are a candidate for thrombolytics.
Right. So what makes the stroke center at Bronx Lebanon so special?
Well, we have a well-versed team. We have continuing education. We have 24-hour neurologists on call. We have 24-hour neuroradiologists available to read the CAT scans. We have a system set up that a stroke alert is called. The operator notifies all the important individuals, and we rapidly evaluate the patient for treatment.
Okay, go ahead. No.
Okay.
Yeah.
Now let's go into a little more detail on the risk factors for stroke. I'll turn
Sure.
to you, Dr. Diallo.
Sure. So risk factors for stroke, I mean, you can divide it into two categories, like modifiable risk factors and non-modifiable risk factors. So non-modifiable risk factors like age, age above 55 years of age, that puts a person at risk more for
Right.
stroke. Then gender,
Right.
and we have seen that men are more susceptible and more at risk for stroke compared to women, but
I'm going to
women...
interrupt you
Okay,
for a
just a minute,
second.
Susan, can we get the question from you?
Hello?
Hello, how are you doing?
Hello, good evening. How are you?
Pretty good.
I have an inquiry in regards to strokes. I'm not sure if it was mentioned beforehand, but I wanted to know what would happen in the case that a loved one has a stroke in front of me. What do I do in the case that I'm far away from medical services?
How far?
Well, I'm about 4 miles away or so, but I don't have a car, and it's usually inconvenient.
Okay, you want to answer that question?
Okay, talk to the camera, Dr.
Sure.
Diallo.
So it's thanks for the question. It's a good question. So you're never far from the hospital and designated stroke center. So the first and the foremost thing is make sure the patient is safe. That means if the patient has sudden onset of weakness, he doesn't fall, hit his head. So make sure the patient is safe. The next best thing is to call 911 and tell them what the patient is experiencing so that he can be transported to the closest primary designated stroke center where he can be treated immediately.
And they would.
Okay, thank you so much.
Okay, you're welcome. Nice question.
Thank you.
Okay.
Now getting back into the symptoms for stroke and the risk factors.
So the risk factors. So I was talking about the gender. So women tends to live longer than men. So mortality and morbidity, unfortunately, is higher in women compared to men. And then other modifiable risk factors is the lifestyle, the things we eat. So keep a healthy lifestyle.
Right.
Some drugs, smoking, drugs like cocaine. So that puts a person at risk for stroke. So these are like modifiable and
Well, I agree with you on the cocaine, but strokes were common even before that. So maybe
Even-
you can
even
tell
before
us
that.
tell us some of the risk factors. You did.
So the other modifiable risk factors are like high blood pressure.
Sure,
So that's the
okay.
most
Yeah.
important risk factor.
And that's common.
And that's pretty common.
Okay.
And diabetes is another common
Common,
risk factor.
common, yeah.
High cholesterol is another risk
Common.
factor. It's very common.
Yeah.
And certain conditions, heart conditions like atrial fibrillation, which is irregular heartbeat, and that puts a person at risk for stroke because a person with atrial fibrillation, they can form a clot in the heart that can flip to the brain.
I didn't want to defend the drugs.
Right.
But I thought that the regular stuff.
And the
was
other
just
risks
as bad.
also the carotid artery disease.
Sure.
If somebody has narrowing of the carotid arteries in the neck, which are two main arteries taking blood to the brain, so that's also another modifiable risk factor.
Right. And what are your recommendations for prevention?
Prevention is the first and the foremost thing is healthy lifestyle
Right.
and get a regular medical checkup. And for conditions like high blood pressure, diabetes, and cholesterol, eating habits, and stay away from the other habits like smoking, etc.
Right. Okay, now another issue that's come up, and I think it's a good thing, maybe you can explain it to our viewers. What do we mean by the Gold Plus designation and American Stroke Association's Gold Plus quality care?
Sure. So we have, our hospital is, as we discussed before, it's a primary designated stroke unit, stroke center. And we have the Gold Plus award from the American Heart Association and the American Stroke Association. So it's basically, we maintain the data regarding stroke, get on with the guidelines.
Right.
And if we are above certain standards compared to the other hospitals and nationwide, we are provided with this designation Gold Plus.
But this is not the first year. You got something
This
a
is,
couple years ago.
yeah, so we've been getting this for the
Regular,
last
isn't it?
3
Yeah.
years now, yeah, in a row. Yeah.
Okay.
Okay.
Because of the help from the emergency room?
Oh, definitely, it's a team, it's a teamwork, right from the EMS, ER physicians, triage nurse in the ER, neurology, neuroradiology, and neurosurgery.
Okay.
And why is it so important to the community to be classified as a stroke center?
Well, it's a resource that they have in case they're having an emergency. It shows that the team has been proficient in it.
I'm going to interrupt you 1 second. We have a call from Robert.
Yeah,
Robert.
that's Robert. It's not Robert. I didn't see a T at the end.
Yes, good afternoon. Thank you for taking the call. I have hypertension, and am I at risk of a stroke, and is there any medication that can prevent that?
You want to take that?
Hypertension is unfortunately a major risk factor for developing a stroke. This is not a single measurement of blood pressure that's elevated. This is over many, many years. So the recommendation is to control the blood pressure with medications and maintain it at an acceptable level, and that will thus reduce your risk for stroke.
There may be other things to do also
Right.
with the patient.
For blood
Weight
pressure
loss,
reduction.
etc.
Sure, weight loss,
Eating
exercise,
properly and stuff.
healthy
Okay.
diet, of course.
On that note, let's pause for a short break, and when we return, we'll continue to take calls from you, our viewers. Once again, the number to call is 718-960-7261. That's 718-960-7261. And please call us.
During this, our year of women's health, we take pride in the extraordinary success of our women's health programs. And when it comes to caring, our OBGYN team is second to none.
At Bronx Lebanon's Women's Health Center, its labor and delivery unit, and Center for Gynecological Care, services are provided in a welcoming environment.
Women in the Bronx can always depend on our OBGYN team for expert, compassionate, and highly specialized care. We deliver the best in women's health services.
Bronx Lebanon's intensive care unit is providing treatment for pregnancy and gynecological related conditions.
We work with our multidisciplinary team to stabilize our patients. Following discharge, we refer them for outpatient care at our Health and Wellness Center.
Winning the battle against breast cancer represents another crucial challenge.
At our Breast Cancer Center, we've implemented a comprehensive approach that involves exam, imaging, and biopsy, which is clearly succeeding in the detection of early cancer.
Significant progress is also being made in the treatment of colon cancer.
Today, I will be performing an endoscopy. Our goal is to prevent cancer. By performing endoscopy and colonoscopy, we are identifying lesions which can be treated at the time of the procedure or referred for surgery.
When illness occurs, Bronx Lebanon's nurses are providing excellent and compassionate care.
We pride ourselves in understanding the physical and emotional needs of our female patients, closely monitoring their well-being and preparing them for the miracle of childbirth.
In the ER, we see some of the most dramatic examples of the Bronx Lebanon team in action.
A high percentage of the patients seen in the emergency department are women, and we are sensitive to their needs. But what is also important is that our ER is helping patients overcome all types of emergency situations.
And keeping its female and male patients moving in the right direction is Bronx Lebanon's Department of Orthopedics.
Our programs are among the best in the nation in treating bone and joint problems, including hip, knee, and shoulder replacements, as well as spine, hand, and foot surgery.
The Department of Family Medicine is another Bronx Lebanon success story.
The close relationship we have developed with women and their families has become the driving force in our efforts to provide comprehensive primary care to the community.
Bronx Lebanon is also leading the way in anesthesiology, dentistry, ear, nose, and throat, men's health, neurology, ophthalmology, pathology, pediatrics, psychiatry, radiology, medical education, and long-term care, as well as through its Bronx Care Outpatient Network, and with the completion of its Health and Wellness Center for Ambulatory Care, Life Recovery Center for Chemical Dependency, and selection as a New York State Performing Provider System lead, Bronx Lebanon is positioned for continued success.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7261 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7261. Now, before we continue our discussion, I understand we have a call from Michael.
Michael, yeah.
Michael, you're on the phone. Michael?
Oh, yes. Hi. So I have a question regarding mini strokes. So I recently know someone that had suffered from a blood issue for whatever reason, whether it was age or maybe poor cholesterol, and resulting was a series of what was called mini strokes. I wanted to know how common that is, particularly with patients that are suffering from such an issue, and if so, are there any known medications, whether over-the-counter or typically prescribed, that can result in mini stroke as symptoms and or just any stroke-related conditions? And on top of that, how to ultimately prevent such issues from occurring after such an injury?
Good question.
I'm going to take it first, Dr. Diallo.
So mini strokes, in medical terminology, we call it like transient ischemic attacks, where the symptoms happens for a few minutes or a few hours, and then the person goes back to their normal state. It's very important for these people to get full medical checkup and what is the reason, what is the cause behind mini stroke. It can be uncontrolled risk factor, it can be clogging of the blood vessel, it can be uncontrolled diabetes, so many things. So the first and the most important thing is to get a complete stroke workup done in these patients. Secondly, if somebody has known history of transient ischemic attacks or mini strokes, antiplatelet or blood thinners, simple blood thinners like aspirin or Plavix may be a good choice. But I don't know of any over-the-counter medications which can prevent mini strokes.
Aspirin is already
so aspirin,
pretty much over-the-counter.
It's pretty much, yes, over-the-counter. Yeah. So, but definitely the first and the most important thing is to get a complete workup for these patients.
Okay, thank you very much.
All
Good
right.
question. Good question.
Now, the question we often ask our panelists is to share their respective success stories with our viewers. And I'm going to start with you, Dr. Gottesfeld, because I'm sure in that ER
I've seen
there's
it.
a lot of dramatic turnarounds.
We've had some great stories. For example, a 62-year-old male showed up with aphasia, unable to properly express himself verbally. He came in early. We were able to administer TPA on a timely basis, and watching him in the emergency department before he went upstairs, his speech started to return, not fully, but as time went on, I understand that he improved to nearly complete recovery, and it was just amazing to see how he, in front of my eyes, started to speak again.
Yeah, that's good. What really facilitated that recovery?
Well, I think what was the critical piece of that was that he showed up to the ED on time as soon as he could, right after the onset of the symptoms. We rapidly got him through the process of CAT scanning him, having the neurologists arrive, and we made a decision at that point to administer TPA, which is the clot-busting drug.
Okay.
And
Aren't you glad I answered that question?
Yeah.
Okay.
And that's what I believe led to his resolution of his symptoms.
Okay, good. Let us discuss the recovery process from a stroke. What types of rehabilitation treatments are involved? What do you do to get a patient back to close to when he was really functioning properly?
Maybe the neurologist could have a better explanation for that.
Okay.
Yeah. So depending upon the deficits.
Yeah.
If
we'll give a little range.
Yeah. So if there are some strokes where they have no weakness but some slurred speech and dizziness.
Yeah.
So those are like sometimes minor strokes, and these symptoms improve after some time. But then there are symptoms in which the patient is completely aphasic, as Dr. Butterfield said,
extremities are compromised,
and totally plegic on one side, where they can't move their arm and leg.
Yeah.
So in those cases, physical therapy and there's extensive rehab which goes on for like weeks and sometimes up to months. So from like the hospital, these patients, they go to acute rehabilitation, and acute meaning they participate in rehab and physical therapy for at least 3 hours in a day, and it goes on for weeks and months.
As needed.
Now, a question that follows from Dr. Gums is, how do individuals in our community gain access to your services? Are they referred by other doctors, or can they come right in to see you?
So some are referred through the primary care physicians outside the hospital, and some are referred from the primary care physicians inside the hospital. And if
some
they
come
want,
by ambulance.
And some come by ambulance to the emergency room, yes. And they can call the hospital number, to make an appointment.
Okay.
Okay, good.
Now, in terms of some of the cases that come into the ER, can you give us a few more success stories? Are there young people that also get impacted by this as well?
I haven't seen, fortunately, many young people with true strokes. So that, I mean, many years of experience. That's an unusual occurrence.
Do you see more women, for example, than men, or is it fairly equal?
My experience is equal men and women. And again, the profound neurologic deficits, weakness of an arm, or inability to walk because of weakness of a leg, and they improve with medication.
Okay.
Okay, can you describe the care that occurs with the administration of TPA? Tell me something about that. What's that? What is it?
TPA is tissue plasminogen activator.
What does it mean?
It's a clot buster. That's, I think, how most people will acknowledge its name, is that it dissolves blood clots.
Who gets it?
Well, there's a checklist of contraindications and indications. People have to fit into the inclusion criteria. They have to, number one, present to the emergency department in a timely fashion. It means that we have to administer the drug in less than 3 hours, ideally. So they have to arrive as soon as possible. That's why if any family or a friend or loved one notices that a person's having symptoms of a stroke, you have to call 911, bring them to the ED as soon as possible. That way we can get the process started.
There's one of the slangs that you all use. Time is
of the essence.
What's the time is of the
time
essence?
Time is brain.
Time is brain.
Yes.
Yeah. Okay. Yeah.
But CPA is, it's a medication that has a risk profile as well. So it has the sooner it's given, the safer it is. But there are some patients who are at a higher risk for some of the complications as well. So we have to very carefully make a decision with the family and the patient as to who's eligible to receive that drug and who will benefit from it.
Okay, good. Okay.
Do strokes repeat themselves in individuals? What's the situation regarding that?
Yeah, sometimes they do repeat, depending upon if the risk factors, like how well controlled are the risk factors, and what are the main risk factors in these patients.
Okay.
Sometimes TIA repeats, but we have seen majority of the times the TIA is a mini stroke, And majority of the times, if a person has 2 or more mini strokes, they end up having a large stroke if they don't get enough, adequate medical treatment.
Obviously, there are tremendous advances now occurring in this field. What do you see on the horizon for our viewers and for your future patients?
So future patients, the extended time window for this clot busting agent, it can be given up to 4.5 hours now. And then there are interventions we can do. We catheterize or put a wire inside and try to take out the clot, pull out the clot from a blood vessel which is blocked. So that's another intervention. And we are striving for like longer treatment windows in these patients.
Okay.
Okay. I want to expand just a little on some of the terms we spoke about before on prevention. Diet, exercise, and what about taking aspirin? Who should take aspirin?
So aspirin, as per the recommendations, if somebody has 2 or more risk factors, and depending upon their age,
give me an idea.
Simple risk factors, but important ones like high blood pressure, diabetes, high cholesterol, and if somebody has peripheral vascular disease, which is blockage of the arteries, if somebody has heart disease and blockage of the arteries in the heart, so those people are like mainly.
And Dr. Goddard, any quick advice for our viewers?
Exercise. What about exercise?
Exercise. See your doctor regularly for cholesterol, blood pressure, diabetes checks, and know the symptoms of stroke. If there's any suspicion.
Can you repeat them for our viewers one more time?
Well, a simple way is a FAST, fast, facial asymmetry, sudden onset of a facial difference in each side of the face, an arm that gets weak and not as strong as the other one, and speech. Maybe you're not expressing yourself clearly with your words, or you're saying the wrong words.
Okay,
so those are all.
On that note, let me thank you, Dr. Diallo, and you,
you.
Dr. Goddesfeld, for joining with Dr. Gums and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for tuning in this evening.
If any of our viewers have questions or need assistance, I encourage you to call our Physician Referral Center by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and see you next week when we will be discussing another important healthcare topic. Good? Not bad.
Thank you.